Sex should never be painful. If you're dealing with discomfort during intimacy or your partner is struggling with pain, it can seriously affect your relationship and overall quality of life. What's even more frustrating is that many people visit multiple doctors without getting clear answers or finding a treatment that truly helps. I'm Dr. Rena, a urologist and pelvic surgeon, and today I'll be explaining the most common reasons women experience pain during sex. If you're a man, please consider sharing this with your partner or any woman you know who may be going through this. And if you'd like me to cover causes of pain during ejaculation or orgasm in men, leave a comment below and I'll create a video on that too. The leading cause of pain during sex in women under 50 is something called vulvodynia. So, what is vulvodynia exactly? It's a condition where even light touch to the vulva causes pain. The vulva refers to the external area around the vaginal opening, not deep inside, but the outer region. I didn't include an image here because YouTube might limit the visibility of this video if I did. Now, what can cause vulvodynia? There are actually several possible reasons. It may be related to nerve issues, muscle problems, hormonal imbalances, or even genetic factors. So while there are many potential causes, the good news is that there are also treatment options available. Let's start with simple, conservative steps that most women can try. These are aimed at improving comfort. For example, wearing cotton underwear is helpful since other fabrics may irritate the vulva area. It's also important not to overwash. Gentle cleansing with lukewarm water is enough. You can let mild soapy water run over the area, but avoid scrubbing or harsh hygiene practices, as these can lead to skin irritation or conditions like dermatitis. You should also stay away from heavily scented soaps and detergents, as they can further irritate sensitive skin. Another helpful tip is to change out of a wet bathing suit as soon as possible after swimming. Sitting in damp clothing for too long, whether it's from regular or chlorinated water, can increase irritation. Beyond these basic measures, other treatments for vulvodynia may include pelvic floor physical therapy, as well as hormonal creams containing estrogen or testosterone. These have been shown to reduce sensitivity in the vulva area. In some cases, treatments like injections, including Botox or anti-inflammatory medications, may also be recommended to help manage the pain. There are also numbing creams, such as lidocaine or products like Emla that contain lidocaine and prilocaine. While these don't treat the underlying cause and act more like a temporary solution, they can provide significant relief and make a noticeable difference. You can also consider delay sprays, which are usually marketed for men. These often contain the same ingredients, lidocaine and prilocaine, and they may help ease some of that discomfort as well. The next most common cause of pain during sex in women over 50 is something known as genitourinary syndrome of menopause. This condition affects more than half of women going through menopause, and what many people don't realize is that menopause or even perimenopause symptoms can begin as early as age 46. So, what exactly is genitourinary syndrome of menopause? As your body transitions through menopause, hormone levels, especially estrogen and testosterone, start to decline. When estrogen levels drop, the pH of the vagina rises, and that shift can lead to a number of issues. It can cause the vaginal lining to become thinner, which often leads to dryness, and that alone can make intimacy uncomfortable or even painful. If the tissue is dry and delicate, it's naturally more sensitive. In addition, the higher vaginal pH can increase your risk of bladder or urinary tract infections, because a lower pH normally helps protect against the bacteria that cause these infections. Other symptoms linked to genitourinary syndrome of menopause include vaginal dryness, along with burning or itching sensations, and sometimes even discharge or light bleeding. On top of that, as mentioned earlier, you may find yourself dealing with more frequent urinary tract infections. Some women also notice urinary symptoms, like urgency or frequency, meaning you may feel a sudden, strong need to urinate or find yourself going to the bathroom more often than usual. So, what can be done about it? The most common and effective treatment is the use of estrogen applied directly to the vaginal area. This can come in different forms, such as a cream, a suppository, or a small ring. The dose of estrogen used in these treatments is very low, so side effects are minimal. It's quite different from oral estrogen therapy, as the amount absorbed into the bloodstream is extremely small. This means you generally don't have to worry about issues like breast tenderness, blood clots, or an increased risk of breast cancer. In fact, research has shown that vaginal estrogen does not carry those same risks. Because of that, many women who are experiencing these symptoms can safely benefit from using it. Another factor that can lead to pain during sex is simply not having enough lubrication. It may sound straightforward, but there are actually several different reasons why lubrication can be insufficient. It's not necessarily that your partner isn't arousing you. Sometimes feelings like anxiety or fear around intercourse can play a role. In other cases, there may not have been enough foreplay, or there could be a history of sexual trauma or abuse that affects the body's natural ability to produce lubrication. The good news is that lubricants are widely available, affordable, and come in many different types. In the meantime, it's very simple. You can try water-based or silicone-based lubricants, or even look in your kitchen for options like coconut oil or olive oil, which can work quite well. For many people, these can make a significant difference in reducing discomfort. There are also several underlying reasons why lubrication may be insufficient. These can include hormonal imbalances or the use of oral birth control pills that contain estrogen and progestin, which may lead to vaginal dryness and pain during sex. Conditions like diabetes or certain neurological disorders can also contribute. A history of chemotherapy or radiation treatment, as well as medications such as antihistamines or anticholinergics, often used for bladder symptoms, can also result in dryness. I'll provide a list of common medications and causes on screen, so you can pause and take a screenshot if needed. Another very common issue I see in my clinic is pelvic floor dysfunction, sometimes referred to as hypertonic pelvic floor muscles. There are several possible causes for this. High stress or anxiety can contribute, as can musculoskeletal issues like posture or body alignment. Even prolonged sitting can be a factor. In fact, during the COVID period, I noticed a rise in pelvic floor dysfunction because many people were sitting at their desks for extended hours at home. This kind of muscle tension can build up over time. Often there are specific triggers, so the discomfort may not be constant. You might notice it worsens after intense physical activity or following pregnancy and childbirth. The main treatment for this condition is pelvic floor physical therapy. During these sessions, you learn techniques to relax the muscles and identify specific tight or sensitive areas, often called trigger points. You're also guided on how to release that tension, which can significantly reduce pain. I've included a physical therapy locator below to help you find a specialist near you. Another possible cause of pelvic pain or discomfort during sex is pudendal neuralgia. The pudendal nerve is responsible for supplying sensation to several areas of the pelvic floor. This can involve areas like the vagina, the clitoris, the perineum, and even the buttocks, and all of these regions can be affected if you're dealing with pudendal neuralgia. So, what exactly does that mean? It refers to irritation or inflammation of the pudendal nerve. This often happens when the nerve becomes compressed or irritated due to things like long periods of sitting, cycling, horseback riding, or even previous surgeries. The type of pain associated with this can be quite distressing. It may feel like burning, tingling, or sharp, shooting sensations. It's usually worse when sitting and can come and go, meaning some days feel more painful than others. You might also notice heightened sensitivity, where even something as simple as wearing clothes becomes uncomfortable. Part of this may be due to what's called central sensitization. When pain becomes chronic, the body can start interpreting normal sensations as painful because of changes in how the brain processes signals. Treatments for this condition can include pelvic floor physical therapy, medications that reduce nerve-related pain, such as gabapentin or Lyrica, or procedures like pudendal nerve blocks, where the nerve is temporarily numbed to see if symptoms improve. Another cause that doesn't get talked about very often is clitoral adhesions. The clitoris is covered by a small fold of skin called the hood, and sometimes adhesions can form there, causing the skin to stick and making it difficult to retract. When this happens, it can lead to discomfort or pain in the clitoral area, which may be felt during intercourse or even at rest. Additionally, if someone has experienced female genital mutilation, this can lead to various types of pelvic pain, depending on the nature of the procedure. There are many other possible causes as well. Common ones include infections, such as urinary tract infections or sexually transmitted infections. Certain skin conditions that affect the genital area can also lead to pain. For women who are postpartum, pelvic pain or discomfort during sex is actually quite common. In fact, studies show that up to 7 to 30% of women may experience this within the first year after childbirth. Another condition, known as a urethral diverticulum, is a structural issue beneath the urethra that can cause pain during sex, along with symptoms like dribbling urine and frequent bladder infections. Past pelvic surgeries or complications from mesh placed in the vaginal area can also be contributing factors. Lastly, there are several gynecological conditions, such as endometriosis, fibroids, or ovarian disorders, that are known to cause pelvic pain, so it's important to consult your gynecologist to rule these out. This video is meant to give you a broad overview of the many possible causes of pain during sex, and more importantly, to serve as a reminder. If you or your partner are experiencing this, please seek help. There are solutions available, and you don't have to live with ongoing discomfort. You deserve a healthy and fulfilling sex life. As always, take good care of yourself, because you truly matter.